So what's the best incision for a breast implant? Dr. Ennis, Ennis Plastic Surgery, Boca Raton, Florida. Patients always ask, which incision is best for me? I've been to see other people, they've been to see other doctors, and they say, oh, you're not a candidate for a transaxillary breast augmentation. You're not a candidate for a perirelar incision. So what's the best option for you? Well, reality is that if you're just getting implants, all three options are fine. It really just depends on where your scar is. Now, there's some benefits and risks of each one. The incision around the nipple oftentimes does affect the sensation of the nipples. A lot of girls say their nipples are numb after that and can affect breastfeeding. The downside, there's a little semicircular scar that looks a little bit like a smiley face under the nipples. It's an okay procedure. A lot of surgeons prefer it because there's no scar here. But what we're grounded is they're trying to get the scar off the breast and hide it someplace you can't see it. Next is incision underneath the breast. Well, that's fine if you've got a little bit of a fold to your breast and you can hide that in a fold so you don't see it. But the girls that are small-breasted that typically need implants don't have much of a fold. And so the bathing suit right up a little bit, somebody still out a shirt on, you see matching scars, pretty obvious what you've had done. Now, unfortunately, that incision is necessary for some revision surgeries, but not all. So my preference is the underarm. It's a little small incision hidden way up in the crease of the underarm. Now, surgeons will say, they can't do it for this reason, they can't do it for that reason, you're not a candidate for it. Reality is they probably just don't do it. So you got to have a lot of fancy cameras. Everything's done through little 5mm cameras. You look on the inside, done on big TV screens like this. So you have to be comfortable doing it. Having done thousands of these, it's not a big deal. So almost all the breast implants I do the underarm. The goal of the procedure is to enhance your breasts and make them look better. So why would you add a scar to them? So we want to put the scar in your underarm, hide the scar in the crease of the underarm. Nobody thinks the underarms are really sexy anyway, so it's a great place to hide the scar. Then you're not self-conscious about a scar if somebody sees your breast or if your bathing suit right up a little bit. And you don't have the issue of sensation of nipples. So my personal preference, underarm incision, transaxillary, easy to place to the silicone. Even the bigger silicone implants can be done through the underarm. Now, people say, what about revisions? Other surgeons say you can't revise anything. The only two things you can't fix to the underarm, if the implant gets hard, you get what I call a capsular contraction. Unfortunately, you can't go in there and take that scar tissue out through the underarm. The other thing is the implant drops too low, you can't raise it back up to the underarm. You can't do what they call capsulorrhaphy. It puts sutures under here to raise an implant that's dropped too low. So those are the only two things you can't do. And you want them out, you want them bigger, you want them smaller. Yeah, all those things can be done through the underarm, no problem. So revision surgery certainly can be done through the underarm by an experienced surgeon that's used to doing transaxillary endoscopic breast augmentation. All the highly cohesive silicone implants can be doing that way as well. So if a surgeon tells you they can't be done, probably not comfortable with doing it, and that's why they're telling you that. So transaxillary breast augmentation is certainly the way to go.